After screening for increased risk and assessing to optimize therapies, intervene by implementing your plan.
Patients oftentimes have a special relationship with their pharmacist and see them regularly, so they can provide patient education as a trusted resource.
As one of the most accessible members of the healthcare team, your patients and caregivers look to you as a medication expert and health educator.
One of the things that I think is really important in working with older adults is also educating caregivers or family members, whoever's living with that patient. So often in practice, we think about providing the education right to the patient, but we may also need to provide the leaflets or the websites or the apps to the caregivers so that they're on the same page and everyone can then advocate for the patient.
Educate your patients and their caregivers on how to monitor side effects from their medications. This will help them recognize and relay their symptoms to their healthcare providers.
In our clinic, we really want to provide as much patient education as we can so that our patients really understand why we're making medication recommendations and why they may want to follow up with what we're recommending to get benefit.
While implementing medication changes is the most important intervention a pharmacist can do, you can also address other modifiable risk factors through education or referral. You can intervene to help patients manage orthostatic hypotension, understand the importance of vitamin D, and improve home safety. Additionally, you can encourage patients to find programs to maintain or improve gait, strength, and balance, and stress the importance of regular eye exams. Pharmacists can help patients recognize orthostatic hypotension and manage it. This condition affects 1 in 4 older adults.
Some of the ways that we help manage orthostatic hypotension in our patients is, first and foremost, education to patients. We want to make sure that they know what it is and why it's happening. One of the patient education brochures that we have, a CDC has one called Postural Hypertension that we do give out to our patients for more education.
Next, pharmacists can educate patients about the importance of vitamin D.
Vitamin D is a vitamin that we know is important for balance and muscle strength in older adults. Also, it is important for bones in those patients who have osteoporosis, for example. And we know that several national organizations have recommended vitamin D in low doses on a daily basis for those patients who have a fall history. In our older adults, they often may not respond to vitamin D in their body from the sun. So they do need to take supplements, and we often recommend 800 units up to potentially 2,000 units a day in our older adults to prevent further falls.
Vitamin D has been shown to improve bone, muscle, and nerve health. Yet data show that many older adults don't get enough vitamin D. The American Geriatric Society and the U.S. Preventative Services Task Force both recommend supplementation. Consider at least 800 IU of vitamin D per day. Supplements can be recommended without testing vitamin D levels in most patients. Patients that may need further evaluation include those with osteoporosis, kidney stones, advanced renal disease, certain malignancies, or sarcoidosis that can result in hypercalcemia. Pharmacists can also provide resources to help older adults and caregivers improve home safety.
I really like the CDC resources that have simple step-by-step recommendations for patients to go into their home environment and evaluate their risk for fall in the home environment. We know that most patients do fall at home.
Since physical activity is so important for health and well-being, pharmacists can encourage patients to participate in home or community-based exercise, especially those that focus on improving strength and balance, like Tai Chi. You can engage with community partners and local health departments to identify local community exercise and fall prevention programs. Begin your inquiry with our list in the resource section.
We've successfully worked with several organizations for fall prevention services, such as YMCA, ADRCs, Aging and Disability Resource Centers, and particularly senior centers. They have some senior centers will have fall prevention programs, and one in particular I have in mind is Stepping On. And Stepping On is a rigorous, about 8-week course that gives you exercises, increases your self-efficacy, and then has a social support component to it as well.
When you identify a patient with gait, strength, or balance problems, help connect them to services like physical therapy.
I also try to make sure that I am aware of when patients would be eligible for physical therapy so that I can be someone to also advocate for that patient related to physical therapy needs.
As pharmacists, stress the importance of regular eye exams and early detection of disease to help maintain eye health and vision. The American Optometric Association recommends annual eye examinations for everyone over age 60. People with diabetes or hypertension, or who are taking medications that have eye-related side effects, are at greatest risk for developing vision problems. It's been 2 weeks since Mr. Adams was discharged from the hospital, and he's scheduled to follow up in the primary care clinic. As the ambulatory care pharmacist, you review Mr. Adams' recent hospitalization to help guide your discussion during his visit. You're concerned that he is at an increased risk for falls. You decide on topics to review with the patient at the upcoming visit. On the day of his visit, Mr. Adams arrives to see his primary care provider and you, the pharmacist, on the healthcare team. While waiting, Mr. Adams is asked to complete the Stay Independent brochure. Just before meeting with him, you refer to the Preventing Falls in Older Patients Provider Pocket Guide to remind yourself of the assessments and interventions that may be appropriate. When you see him, you review and discuss his responses to the self-assessment.